event here with Michelle. So we'll just give it a little minute or two. Hopefully Tom will be able to join us. Great to have you with us, Orleen and Christine, and obviously Michelle as well. And once we get started, we're going to have, actually this is going to be a bit of a different session, so there's no prepared presentations. This is going to be more of a conversation and a chat, and I have some questions that I'm going to ask everyone, but also ask a few organisations individually as well, just so we can get to know the work that you're doing and to hear some of your reflections and some of your challenges, some of your learning. And we'll share that together. So here's, I think, Tom coming now. Hopefully, Tom, you can hear me, and you should be able, I've made you a co-host to be able to put your camera on, and we wait for you, Tom, before we begin.
Can you hear us, Tom?
I can hear you. You're not seeing my video? No.
No, we can't see your video.
Let me see here.
You should be able to put it on. I've made you a co-host, so you should be able to select us to put it on there, Tom.
Yeah, just looking here. It says on.
Technology, Tom?
Technology, yeah. So I'm not sure. It's not. I don't know what's going on here.
Oh, we can hear you. That's an important thing.
You hear me? Listen, it's problems with technology. I don't know what is going on here.
That's
I have it here. I have here the video and it's on, but it's not showing up on your end.
That's okay.
Well, maybe begin, will we? And sort of
Yeah,
start.
go ahead. Yeah.
And if it works out video wise, great. But we know you're there, Tom, and we're going to hear from you anyway, whether we can see you or not. So thank you. And so thank you all to Orla, to Christine and Michelle, and to Tom for joining us for our community voluntary sector panel, where we're going to hear from everybody a little bit about what their organisation does, and then we're going to have a conversation generally about some of your learning and some of the challenges you face and some of your expertise in the whole area of supporting parents, particularly in relation to their mental health and well-being. So I'm going to start. I'm just going to ask each of you for a couple of minutes to tell us a bit about yourself and also a little bit of your organisation, so that people who are with us can get to know you. So Orla, I say you've got your mute on, but can we start with you because you're in that corner of my screen, and can you share with us a little bit about you and your organisation?
Thanks so much, Lindsay. Yes, I'm incredibly polite. We've got the Zoom etiquette down pat at this stage, haven't we, 2 years later? Hi, everybody. Thanks so much to Michelle and Lindsay for the invitation. My name's Orla Fitzsimons, and I'm CEO of an organisation called Parent Action. And we're a social enterprise set up by parent carers for parent carers. And parent carers are parents, obviously, of children, young people and adults, babies, children, young people and adults with additional needs. And we call them parent carers to distinguish them from parents of children who don't have additional needs. And I'm not going to go into a huge amount of detail, but I'm happy to discuss that as we go along, Lindsay. So basically, Parent Action's been working with the parent carers of children, young people and adults with additional needs since 2014, when we were founded. We've co-produced a number of services with those parents based on the needs and the issues that they were telling us about. And I'm happy to, I don't want to steal the parent room's thunder today, but we've connected over the last year, isn't it, Michelle, with the parent rooms and the fabulous work that they're doing, specifically focusing on parental mental health, which is absolutely crucial. So we provide independent advocacy services for parent carers, specifically of children, young people and adults with disabilities. My background, I suppose, is I'm a parent carer of a child with a disability, but I have to remember to mention the other two as well, who don't have additional needs, and they're forever given off because, hang on a wee minute. I'm also a community children's nurse, so I've been working in the health service in Northern Ireland for 25 years, working specifically with parent carers of children, young people and adults with disabilities, and helping them to care for their child in the home, school and community, which is where the vast majority of babies and children with disabilities grow and develop. And we've had to set up an advocacy service because parents since 2014 have been telling us that they have no voice. They have no choice. Public services choose which school your child goes to if your child isn't being excluded from school because of their disability. There's huge issues of disability discrimination in our public services. And the difference between parents and parent carers is parent carers need all of those services. So we're talking about special educational needs support in school. We're talking about nursing. We're talking about children's nursing. We're talking about health visiting. We're talking about social care and social worker input in order to help their child grow and develop and to help them be the parents they want to be. So will I leave it there, Lindsay? And then everybody else can introduce themselves, and then, because I know you want to have a chat then about parent carers and mental health. So thank you.
So much for that, and I'll ask you a very specific question in just a minute, so hopefully we'll hear a lot more about that. But thank you, it's wonderful to have you with us. Thank you for joining the panel with us here today. And Christine, can I come to you and ask you to introduce yourself and tell us a little bit about the work that you do?
Yeah, my name is Christine. I work in the Mind and Mum project, which is based in the Waterside area of Derry. So we're based in the community. I work through the Waterside Neighbourhood Partnership, and we just started in February 2022, so we're only a few months into the project. So it's a 5-year perinatal mental health project, and we're funded by the Big Lottery Community Fund, NI.
Wonderful, thank you, Christine. And then we'll have a few questions directly for you as well, along with some group chat too. So it's wonderful to have you here, Christine. Thanks so much for joining us. Tom, we still can't see you, but we'll definitely be able to hear you. So could you introduce yourself and tell us a little bit about your organisation? And we should say, because you might not say it, that your organisation is one of our sponsors here today for the conference. So thank you very much for that.
Good morning all, and thanks very much for allowing me to join in. Sorry about the photograph, I'm not sure what's going on there, but delighted to be on screen anyway. I'm Tom McNaney, Head of Support Services, and I have a second role in relation to the Regional Coordinator for the Maternal Mental Health Alliance, Everyone's Business. So I have 2 hats on with me this morning. So one of the issues, obviously, perinatal mental health is one of our key issues for Aware NI, and we have a number of programs that we deliver in early intervention, parent and mood managed parent and baby, and all of that. But delighted to be here. I know we'll get into the discussions about how we all work together and what we can do, because Lindsay and Michelle and I, we've all been involved very closely with developing the specialist perinatal mental health teams, but there's a lot more work to be done. So listen, I'll hand it over to someone else there at a minute and join back in a few minutes. Yeah.
Thank you, Tom. And then Michelle, finally, we'll come to you. Michelle, I know we've heard a little bit from you, but some people might not have been in the first session, so tell us who you are.
Sure, I'm Michelle Bradley. I'm the CEO of the Parent Rooms, and we provide mental health support specifically for parents in Northern Ireland of kids of all ages.
Fantastic. Thank you, Michelle. So as I said, we're going to have a couple of questions where that we ask everybody the same thing, but because we realise that organisations do different things at different times, we've got a few specific questions for specific people. So actually, Orla, I'm going to come back to you if you don't mind. I know I came to you first last time, but I'm going to come back to you.
All right.
And I realise that you do a wealth of work, and there are an awful lot of things you could pick up on, but maybe could you tell us a couple of really key, significant, unique challenges that parent carers face, and how your organisation supports them, just to give us a little bit more of an in-depth idea about the work that you're doing and what we should be picking up on.
Okay, so and I know that everybody was at Michelle's opening speech there this morning, or presentation this morning. So as parents, because we're parents first, because our children are children first, I think that the main challenges that we face are very, very similar to parents who that Michelle was laying out, of parents of children who don't have additional needs. In addition to the pressures and stresses, I think you talked about, Michelle, lack of support, isolation, lack of knowledge and access to different support services at different stages of becoming a parent, right through the perinatal phase and through pregnancy and all that, and into early years, childhood, into school and all that sort of stuff. It's exactly the same for parent carers. The difficulty is that our services in Northern Ireland are based on a medical model of disability, which means that the diagnosis of your child, or the disability that your child has been diagnosed with, which is the case for all children with additional needs. If they don't have an official diagnosis, they have what's called developmental delay. The services that currently exist don't allow you as a parent to find out information about them and get access to them easily. And this is when you, because I know that Michelle and Lindsay, you as well, will have engaged with parents of children who have been born with or diagnosed with some sort of disability or additional need. It doesn't really matter what it is. Unfortunately, our services look at the label, look at the diagnosis, and have very strict and sometimes discriminatory criteria about what children can access those services. And it's left to parents to go and find out what that is. Some of our parents have children who have really rare conditions, conditions that mean that they're going to be life limited in childhood. And some of them are unfortunately, sadly going to die in childhood. And there's no connection. There's an assumption that when that diagnosis happens, the parents get all the support that they need, or that the diagnosis itself is easy to get. And we know from things like the new autism amendment bill that's come through. For example, if you're applying for your child to be assessed, you think your child possibly may have some developmental delay or autism, it'll be 14 months after you tell your GP that you want referred before your child's even seen for an assessment. And 14 months is a huge period of time in a child's life. So with relation to parents' mental health, particularly when you're talking about parent carers, all of our parent carers come to us in mental health crisis. And that actually means that all of their children are in mental health crisis. And the vast majority of them have been there for years when they finally reach out and try and find some sort of way to get support. So our services are very similar to, we have a lot of commonalities, don't we, Michelle, from the parent room's point of view. It is focusing on enabling and empowering that parent to be the parent they want to be. And unfortunately, for parent carers, they come across huge barriers in getting the vital public services that they need to make sure that their child gets the same access and inclusion in their communities and schools and any other services that they need, which children with disability who don't have disabilities simply don't face, because parents have all of those challenges that Michelle was talking about. Parent carers then have additional challenges that I need a particular service and I can't get access to it, or I am on a waiting list for years. So this isn't just coming from Parent Action. There's lots of evidence base from the Children's Commissioner's Office in recent years, from the National Children's Bureau and all this about the different experiences that children and young people with additional needs face. So as regards parent carers and their mental health, if you can't get the child the help you need, or the services that your child is getting are actually harmful, or people that are engaging with your child don't have the skills and training, which very unfortunately often happens, parents have no way to complain about that that's effective. The complaints processes don't work. So you're into a cycle of battles, etc. So that's where the trauma comes from. And like Michelle was saying this morning, there's very little parent-specific mental health support. There's very little recognition that while you're battling away for your child, like Michelle said this morning, because you're going to battle for your child and put yourself and your own needs last, and that's what you're sort of expected to do. For parent carers, again, there's no way for them to resolve that. And like I said, their mental health and emotional well-being impacts directly on the mental health and emotional well-being of their children, which impacts on their development, which impacts on their well-being, which impacts on the whole family and on the community. And social isolation is a big thing. So until parent carers get access to those particular services, they can't enter any sort of therapeutic or recovery journey as regards their own mental health. And that's where our independent advocacy services come in. So we enable, we empower, and we connect parents with other parents who are having similar experiences, parent carers, because like Michelle said, they're the ones who know exactly what you're talking about. You don't have to explain yourself, or they will immediately understand what you're going through. And that's through our parent-to-parent groups and our parent care networks, which we're developing over the next few years, which is helping parent carers to engage with public service commissioners and providers and tell them what the problems are, to fix them, to make their services easier to access for the children. And then there's a huge activism side of things that we do, because all parent carers who come to us don't want any other parent care to go through what they've been through. And they're all and I know Michelle has this experience as well, and you have, Lindsay, as well. We all just want to support other parents to stop them going through what we're going through. So the peer advocacy side of what the Parent Rooms does is absolutely huge on enabling and empowering parents towards a journey of resolving those issues and then getting the services their child needs, and then beginning a recovery journey for their own mental health. So that's really the main challenge, Lindsay, in answer to your question, is really about what parent carers want is their children to get access to their human rights of access in school and mental health and social care services, which they currently can't get the way public service systems and services are designed. So that's the big challenge for us. Thanks.
Thank you, Orla. We could listen to you all day, so thank you so much for
I'm
all.
sorry, I could talk all day. Michelle knows that.
No, really important. And actually, I think I'm going to come to you next, Michelle, because I think there might be some in that you want to pick up on. Thinking particularly, I know we've talked a lot about this even behind the scenes, about the real need for parent-specific support from your point of view. So do you want to pick up a little bit of what Orla said, but also even take a chance to answer that question, if that would be okay?
Yeah, absolutely. I know from my own experiences as a parent, whenever I was going to seek mental health support and there wasn't anything that was parent specific, and you're kind of going to general groups, or you're going to general supports, you're going to general counselling, it's very difficult for the person on the other side of that room, or the other people in that group, to understand that you're dealing with all of the same things they're dealing with, but also you have caring responsibilities, and caring responsibilities isn't just organising childcare and feeding them and keeping them warm and going to bed. You're also trying to grow mentally stable, happy children who are going to turn into productive, healthy adults. And people forget that as a parent, you're literally raising the next generation who are going to be working, who are going to be contributing to the economy, who are going to be educating the next generation after that. And it's on us to make sure that they're raised in a way that is healthy and secure, and without any support that is parent specific, that identifies all of those challenges. Because trying to grow a mentally healthy child and a physically healthy child, and work and manage a home and manage a relationship and all of the other things that we have to do, if your mental health isn't great, you cannot do any of that stuff. So it's really, really important that we give parents tailored support that recognizes those vast amounts of responsibilities and gives them space that is just for them. Because what we'll also find as well is most parents will go through an identity crisis after their kids are born, where you forget who you are as a person, everything is about your child. The same thing happens with your mental health. You're not recognized as being a person in your own right. Whenever there's a problem with the family, it's usually family support is given, or behavioral management, or very practical support, but that doesn't relate to you as a person who deserves to have the support that you need to have your mental health improved. So.
Yeah, thank you very much for that, Michelle. Christine, I'd love to bring you in at this point. Thinking about the fact that you and the Minding Mums service is relatively new. As a newcomer, what is it that you're hearing that parents really want or need? Because sometimes we're very good at assuming that we know what it is that parents want or need, but what is it that you're hearing, and as you set up your new service in the area, that parents are really asking for or calling for help and support for their mental health and well-being?
In terms of mental health and well-being, I think that they are asking for counselling, which was a big surprise for me, because a lot of the counselling has been so far been referred through health visitors, midwives, social workers, but there has been in the last month or so parents contacting me directly and saying, would we provide any counselling for themselves? So that's key, that I can provide that for them. I don't promote the counselling on social media or anything like that. So everything that you see on our social media is all, the soft touch approaches. So you have your exercise groups, all the fun stuff. But the counselling is very much referrals. So I think it's really key that I have a specific phone for Minding Mum, and the mums can feel that they can text me during working hours and I will get back to them, or they can phone me whenever they want. So even like recently, a mum just contacted me. They're already doing one of our other programs, and they just said, "You do counselling, don't you? Could I have the counselling?" And it's great the fact that they're aware of the wider programs that we do. So it's a way of getting them in the door. And then once the trust is formed, they can, ask for further support. So I found that really great, the fact that there's a lot of programs that we run. And then there's things like the walking group, where you don't have to book, you don't have to commit to do 6 weeks of this, 8 weeks of that. The walking group is just, they can turn up if they want, if they feel they need to get out. They don't have to come every week. I don't need to take, registrations or anything like that. And I find that during the walking group, that I've been able to connect with the mums directly, where I can speak to them privately, and they say, I'm not ready to do specific thing just yet, but you can see that it's making an impact. So for me, I think there's lots of different programs that you could run for mums. You know, all the nice stuff we see on social media, like we do muscle mummies, we do Pilates, yoga, but I think that's just to attract the mums and to make them aware. And then once, you know, I've got them registered, they have the number, then they can connect with me. And I've been finding that's really worked as a strategy to get in to, you know, to get the mums to trust you, basically. And the numbers for counselling have are quite high, which is good in a way, I suppose, but the fact that they know where they can find support.
Yeah, thank you, Christina, for that. It's really because I think we, even with the parent rooms and from listening to others, realise that parents are asking for that counselling and that one-to-one support where they are heard and where they're listened to. And from what all of you are saying, it really is about our services being person-centered or parent-centered in this case, isn't it? And realizing that every parent is an individual, and that what works for one doesn't always work for the others, but actually listening and asking questions and not assuming that we or any other organization knows the right thing, but actually that we need to learn and listen to the parents or the people that we are engaging with. Tom, I want to bring you in here. At this point, you mentioned that you are the campaign coordinator for the Maternal Mental Health Alliance, and we're going to talk in a minute or two more about the specialist services, but the campaign from the Maternal Mental Health Alliance is in a new stage now about making all care count, and I'd love to hear a little bit more about that from you and about why that is so important. So obviously we know the specialist services are important, but in this group here we're even talking about how actually care for parents is much more than just the specialist services, and there are many other ways that we can make all care count for parents that we engage with, or you engage with our statutory services. So could you tell us a little bit about that and why that's so important?
Thank you, Lindsay. As you know, the Maternal Mental Health Alliance has been concentrating over the last number of years on the specialist services and turning the whole map green and getting all the specialist services up and running. The campaign now is campaign for make all care count for all families, and that's basically, we all know that there's a need at primary care, at prevention and early intervention for the mild to moderate who do not meet the criteria for the specialist. And that's what the campaign now is all about, is making sure that the same emphasis is put to develop services that will ensure that every parent and family get equal access to comprehensive quality, high quality standard service. And the way to do that obviously is working very closely with the infant mental health strategies, getting in there early and antenatal classes, identifying individuals and families at the early stage so that you can give them information, which a lot of families are crying out for, information, education, skills, so that they have individuals, and the individuals can have skills to manage their mental health, to recognize mental ill health, and know where to go to signpost for services. So this part of the campaign is, again, the challenge for us in Northern Ireland is about developing sort of a more integrated community and voluntary sector that can actually work very closely with the specialist teams, but also take on a lot of the roles from the mild to moderate, where we can link in with the specialist teams as well. But just for the families to know that they can access services in every trust and that there's equitable access. So that's basically our challenge now going forward.
Yeah, thank you, Tom. And I know for all those in our panel or for those who are attending, particularly around that, you'd be keen to engage with any organisation who's keen to know a bit more about that campaign, or even how they can feed into or be a part of it.
Absolutely, yeah.
But you did mention the specialist services, and obviously in a couple of speakers' time, we have Dr. Janine Lynch, who's coming on to tell us about the development of those and where they are all at. But I wanted to ask each of you, from your point of view, the new specialist teams are going to be up and running in each of our 5 health trusts. So from your organisation's point of view, how is it that you would hope to or like to work alongside those specialist teams? Because I think that'll be really important for us to hear, and even to be able to feed back into the teams as they get up and running. So from your organisation's point of view, how would you like to work alongside those new specialist teams? And I should say, Michelle has put in the chat that we are running a little bit over time, which we are. So this is going to be our final question to everyone. And then if there are any other questions that haven't been answered, we will send those out to our panelists and ask them to answer them. So, Orla, I'll come back to you and ask you to answer that final question for us, if that's okay.
That's great, thanks. Absolutely, and I'll try to be brief, though I'm not very good at it. talking about the early intervention and prevention thing, Tom, there, that was really, really essential, particularly in perinatal mental health. And I suppose the way that we would really like to work with the specialist focus on maternal mental health and perinatal mental health in the early years is focusing on the early intervention and prevention. So, I mean, a lot of children with additional needs are diagnosed in utero. You know, that's when any sort of perinatal mental health specialist, perinatal mental health support for those parent carers to be. Should start as early as possible, but definitely, and I know there's fantastic stuff going on in the Children's Hospital in Belfast and in the neonatal units, where there are connections being made with public services very early on. Unfortunately, that seems to be, as usual, held up and supported by the community and voluntary sector. And what I would say is that we would be advocating very strongly for that to be a statutory provision. That early identification on diagnosis in utero or shortly after birth of a lot of the additional needs and disabilities that children have, be it through birth trauma or genetic conditions or whatever it is, that's where perinatal mental health needs to be kicking in, but they also need to provide, you know, ongoing support. These children are going to have these disabilities and needs all their lives. We need to start planning early, to prevent mental health and emotional well-being issues in their mums and dads, but also for the child themselves. And I do feel that children with disabilities, infants, neonates with disabilities and with long-term health conditions have been left out of that discussion up to now. So it's really important that's how that is. So early intervention and, you know, back up the community and voluntary sector and all the stuff that they're doing. It needs to be a statutory service provision. Thanks very much.
Thank you, Orla. Thank you for that. And Christine, how about you? How would you like to work alongside the new specialist teams, particularly in your area and in the Western Trust?
Yeah, I think I agree with Orla. It should be statutory. I think that although I keep saying we, I have to remember that I'm very much doing this myself. This is in the community. You know, like I have an admin now, but it's very much there's not a lot of people that work in each team. I think people think that we're some huge organization. We're not. So it would be great to link in with the specialist teams, just like regularly, just to have that extra support, extra funding. You know, if they need us to do certain things, then that needs to be backed up and funded as well. There's always, you know, phone Mind a Mum, phone Christine. You know, she'll have something. But that needs to be backed up as well with extra funding, just maybe more staff, I don't know, but just something that there's not just, you know, like, you know, that we might not always be here. We're very much here because we applied for funding and we were successful.
Absolutely, and that's such an important point and something that Tom and I have been even saying behind the scenes for quite a while around the community and voluntary services needing proper funding if they're going to be able to continue to do the really important work that they do, and also if they can continue to work alongside the specialist services as they need to do in order to make sure that we do meet the needs of all mums. But funding is actually really key to allow those vital services to continue. Michelle, can I bring you in here and just ask you for a second or two to reflect on that question?
Yes, absolutely. And I completely agree with Christine. I think a lot of the times community and voluntary organisations are kind of left to pick up the pieces without sustainable investments. So sustainable investments is a very, very important part. For us, I think one of the biggest things is that we have a collaborative partnership with all of the specialist teams across Northern Ireland. We have a really good partnership with the Belfast Trust, and we'd like to extend that out to the other trusts as well, because I believe that we can't work in silos. It can't just be our pitch and their pitch. We have to be able to work together and be able to come together in the service of the parent. So having those really good, strong collaborative relationships and being able to speak to each other in a very open, transparent way to say, here's what our needs are, here's what your needs are, how do we work together to address these problems? It's not us versus them, it's us and them facing the issues that are facing the parents.
Thank you, Michelle. Tom, I'll come to you for a final reflection. As somebody who's worked in both statutory organisations, who works in the community and voluntary, who's campaigned across both, what are your thoughts and reflections on that?
I totally agree with everything that's been said by all the ladies there. And I think the key thing from AWARE's point of view as well is all the individual members of the families that are involved in the implementation of the specialist teams will require support whether it's peer support, which we're a great advocate for, and also one-to-one individual support and whatever type of support they require. So I think from a point of view, those families need support from the community and voluntary sector, and we also need to integrate on their working closely with their care pathway. So we should be a formal part of their pathway so that they can signpost people, because they're not going to have all the families for a lifetime. They'll be taking them on for a while. They'll need some support, and the community voluntary sector can provide that wraparound service. But I think one service on their own, and Michelle hit it on the head, one can't do it on their own. But I think if we all join up in a collaborative partnership approach, I think we're stronger together, and you can actually have a better quality of support for the individual who's at the center of what we're trying to do. So that would be my key thing. That's where we have a major role to play. And the funding, when you can demonstrate positive outcomes for the families that way, I think maybe funding then can actually follow that, hopefully. And we'll always lobby for that. Yeah.
Absolutely. Thanks so much, Tom. I don't know if you can see, but Michelle was giving you a clap there when you were talking about that, and I think we just did it again. I think we all agree. It's been wonderful to have you all here. Thank you for joining us for this panel. Thank you for your wisdom. Thank you very much for the really important work that you do. We could probably run this panel for a lot longer and talk about a lot more, and there's no doubt more conversations that need to be had, and we will continue to have those offline as well, because I know, and we are all really keen, and we do all work together actually outside of just something like this, but it's really helpful to be able to share together on a conversation like this and allow others to hear and to listen into what it is that we're doing and what we think is important. So thank you, Orla, thank you, Christine, thank you, Tom, and thank you, Michelle, for joining us for this panel. Thank you, attendees. I'm going to log off now and log quickly back on, because we're going to hear next from Darren Beggs, who's going to help us think about how we go about supporting dads and how we do that really well. So do come back and join us for that session as well. But thank you all once again, and I'll see you in just a minute.
Thank you.
Thank you.